Have you noticed that you've been feeling more anxious, depressed, have restless sleep, or overwhelming fear? With our ability to obtain mass information at any moment through technology, including news outlets, social media, and web searches, we may be experiencing what is called vicarious trauma. Vicarious trauma can be caused by a variety of experiences: a personal event or loss, another surge in COVID cases, ongoing incidences of violence, humanitarian emergencies around the world, or uncertainty about the future. These can all trigger symptoms of trauma. This unprecedented time has both taxed people's capacity to cope and endangered the most vulnerable groups in society. I'm Brittany, and I'm here with my colleague Jodee, and today we're going to learn about vicarious trauma. Before we get too far on that, let's learn about the term trauma. Trauma is a term used to describe the aftermath of an event or series of events that can interrupt everyday living by causing depression, anxiety, fear, and at times can make you feel paralyzed. But why does this happen? What is going on in our brains and bodies that makes us feel this way? Our brains are wired to protect us from danger. It's a natural response for survival. During stressful times, our brains will release a chemical called cortisol. This is a stress response activated by what is called the amygdala. This response is also known as the fight, flight, or freeze. When we experience trauma, our brain processes this information, reacts, and stores its interpretation of the event away for future use. This means the next time that you find yourself in a similar setting, your brain will release that chemical to remind you, hey, last time you were here, this happened. Cortisol will release and give you the opportunity to protect yourself from any danger. PTSD occurs when the brain is unable to stop the cortisol from releasing in a non-threatening setting, and the prefrontal cortex is not able to tell the amygdala, hey, I know this happened before, but I'm okay right now, I'm safe, and I can carry on, to stop the cortisol rush. This means that your brain, body, and decisions are in fight, flight, or freeze at all times, and the cortisol is being released full time in the body. The stress hormone that was meant to protect you is now holding you captive. Now that we understand a little about trauma, let's take a deeper look into vicarious trauma.
Vicarious trauma is defined as unfavorable changes in our thoughts, feelings, and behaviors resulting from exposure to secondhand traumatic material. The term was originally thought of for people working in a caretaking role or in healthcare, but over time it has expanded to include everyday people. Today, with the increase of events such as mass shootings, pandemics, natural disasters, violence associated with social unrest, there is more and more information we're exposed to in the form of secondhand. We may find ourselves inundated with these indirect accounts of tragic events, and we may notice that we start to not feel like ourselves, or perhaps our loved ones notice that in us. This can be because of vicarious trauma. It is that emotional residue we notice after the exposure to too much secondhand information of traumatic events. Vicarious trauma can occur when we support and comfort those directly affected by a tragedy, or even by reading or listening to these experiences secondhand. The effects of being exposed to this trauma builds over time. But as Brittany referenced, our bodies and brains keep score of all of this. They hold traces of the experiences, even including secondhand experiences. So we do need to be attentive to changes in ourselves and others. We may begin to live each day with more fear and stress. We may become avoidant of certain situations and places or people. Sleep and appetite may be impacted. Unhealthy coping strategies may be used. In the workplace, we may notice more people calling in sick, people less motivated and disengaged. Some other ways we may notice vicarious trauma manifesting in us include preoccupation with information. Basically, the term doom scrolling is when you're reading over and over again the same information, but different accounts, and not being able to stop. Decreased motivation, sleep patterns being disrupted, emotional shifts, mood shifts, and our sense of safety, both physically and emotionally being compromised. Because of the emotional residue that vicarious trauma can leave us with, it is crucial that we commit to self-care. Self-care refers to selected actions that restore balance in our personal and professional lives. Ways that we can employ self-care include becoming more oriented to ourselves. This means take notice of where your focus, time, and attention is going. Be mindful of nutrition. Prioritize sleep. Make sure to find ways to laugh, whether it's family, friends, or even by yourself. We had a client recently said that one of their favorite things to do was go on YouTube and just look at clips of old movies. And even though it was silly and he'd seen them 10 times before, it was helping. So whatever works. Establish with time, people, social media. With regard to the people, if you're at work or anywhere, maybe you have a friend whom you notice is really preoccupied with recent events and can't stop talking about it. If that's not good for you, then you have the right to set a boundary and to disengage and move your energy and attention elsewhere. We also want to remember to get physical. We know that with research, we need to release the negative energy from our bodies and from our minds. Engaging in some form of physical activity like running, yoga, or walking can help to immediately shake out the adrenaline effect. But you can also engage in playing music, painting, cooking. These have all been shown to dilute the intensity of vicarious trauma as well as transform such emotions. In addition to the self-care methods that I've just referenced, I also want to pause and remember that the ones that I've mentioned so far are helpful and soothing for others. They're also more of a passive kind of unplug, disengage type of theme. And that may work for some, but for others, you might feel inclined to roll up your sleeves, take action, join community organizations, find ways to use your voice. Just note that some work for some and others work for others, and find what works for you. Whether it's our own children, students we teach, clients, or patients we care for, or even employees on our teams, they will look to us to recalibrate their sense of normalcy. With children being most vulnerable, we want to make sure that they are cared for and that we attend to them as much as possible. How do we do so? We want to first remember to be patient with them. Remember, they may not want to talk right away. Some children may actually need more expressive outlets like drawing or writing to share their experiences. Hold space for them to hear about their thoughts or feelings. This means you're allowing them to express themselves without judgment. You're supporting them as they process their feelings. You may want to also avoid the use of closed-ended questions. Reassure children of their safety in the here and now. You want to do the here and now versus past or present in any other tense because the here and now is what we have control over. Observe your child's emotional state. Changes in behavior, appetite, sleep patterns, these all can indicate a child's level of anxiety or discomfort. Engage your child in activities. This can include things that are fun, but also soothing activities like music and unwinding with reading at night. Stay truthful, even about difficult topics. This can include your own experiences and feelings. Even if you've felt saddened, angered, confused, it's okay to share that. Remember to model boundaries with TV, phones, and tablets. Remember that your children are watching you as much or more as you're watching them. Remember how crucial routine is. Ensure that your children get as much sleep as possible, regular meals and exercise. Encourage them to keep up with their schoolwork and extracurricular activities, but don't push them if they seem overwhelmed.
Traumatic events create a domino effect of pain and distress, and there's no one-size-fits-all solution to return to baseline. While we've outlined some coping tactics, you should always consult with a mental health professional to discuss a path to healing that's best for you. Mental health affects your overall health in a major way. Seeking or asking for help isn't a weakness. It takes strength to work hard toward a better health space.